Hey guys, Dr. Ben Edwards here, founder of Veritas Medical and Veritas Wellness. I was a conventionally trained family practitioner for 10 years, and now I've been doing more holistic integrative medicine for the past 12 years. It's amazing to see what the body can do to fix itself when you give it what it needs and avoid what it doesn't. You've probably heard inflammation's at the root of every disease. If you Google the word inflammation plus your disease, no matter what it is, it can be depression, Alzheimer's, diabetes, cancer, heart disease, you name it. There will be a connection between inflammation and disease. Most inflammation is coming from a mitochondria that's not stewarded properly. Your mitochondria is your carburetor inside your cell. That's where your cells make energy so they can perform their job. Our diet and our lifestyle affects our mitochondria. When I have a patient, though, who has stewarded their health pretty well, they're stewarding their mitochondria. Their carburetor has been tuned up by eating real food and getting good sunshine and good hydration and minerals and movement and all the things, but they're still inflamed. I start hunting and looking, and the next place I look is the mouth. The book today, Root Canal Cover Up by Dr. George Meinig. Dr. George Meinig was the founder. He invented root canals. He founded the American Endodontal Society. And a few years later, he came back to the meeting of all the dentists and said, guys, I was wrong. We got to quit doing these. So let me tell you the story today about Dr. George Meinig. But first, I want to tell you about a patient. What really got me onto this. I had a young lady. She was in her probably late 20s, had 3 little boys. She was married. She was, excuse me, very athletic. She was a runner, not excessively. I don't recommend excessive running, and she wasn't. Appropriate running, great on her eating, grew up in a family that was real holistic. So she'd been pretty clean her whole life, really. But she had fever of unknown origin. For over 6 months, she had this fever. Nobody could figure it out. She'd been to lots of doctors. She had these rashes. She had horrible migraine headaches, chronic fatigue. They were trying to diagnose her with an autoimmune condition, but nobody could really figure it out. She'd been to specialists in Dallas, everywhere. She came to see us. I ran through the whole history like we always do, head to toe from birth to now. And she was so clean on everything. Couldn't find anything until I asked her, what about your mouth? Do you have any root canals? And she said, yeah, I've got like my whole mouth is root canaled. Ding, ding, ding. We found our answer. We stopped the visit in that moment. I told her I couldn't help her. Everything in her diet and lifestyle was pretty perfect. She needed to go spend her money with a biological dentist, a holistic dentist that knew the connection between root canals and chronic systemic inflammation, which she was having. And she did, and she got better. That case and many others I started looking at because of this book. Dr. George Meinig figured out that these root canals harbor anaerobic bacteria. So bacteria that require oxygen to live are called aerobic bacteria. Bacteria that don't require oxygen are anaerobes. So when you do a root canal, they drill in there, they kind of clean out, suck out all the pulp and the innards, and then they kill the nerve and they kill the blood supply, the dental artery. Then they wash it out and fill it in. That's a root canal. That's a dead tooth because there's no more blood supply to that tooth. Anywhere in the human body where you cut the blood supply, but you leave tissue that's going to die, it's necrotic gangrenous tissue. If you cut the blood supply to the appendix, it ruptures and dies. You get real sick. If you cut the blood supply to your big toe, it turns black and necrotic and gangrenous. You're doing that with the tooth. That's what these dentists are doing. Now, they're taught in medical school that when they wash it out during this procedure, that sterilizes that tooth, so it's okay. Well, what we now know with modern research, there's 2 miles of microtubules in these tubes. These are tiny, tiny tubes in the tooth, and they don't get washed out. You can't wash out that small of a tube with a little fluid irrigation. So anaerobic bacteria that don't require oxygen live at the base of that root canal tooth, and they secrete biotoxins. Biotoxins are proteins that these bacteria, like anthrax, makes a toxin. Botulism makes a toxin. Tetanus makes toxins. That's what really does the damage. Pertussis, whooping cough, that's actually from the toxin that germ creates. These anaerobes create toxins. They're very, very deadly. According to University of Kentucky professor Boyd Haley, they're in the top 10 of most deadly biotoxins or anaerobic dental bacteria toxins. These root canals that produce these toxins can distract the immune system, They can disrupt the immune system. They can predispose that immune system dysregulation to create autoimmune disease, inflammation in general, chronic inflammation, even cancer. There's some integrative cancer doctors won't even work on a patient until the root canals are removed. There's such a correlation. You can learn about that and more in Dr. Meinig's book if you wanted to take the deep dive. And there's other books about this very topic. Dr. Meinig, once he figured out that his patients were starting to get systemic disease, heart disease, cancer, arthritis, hypertension, autoimmune disease, he would even pull the tooth out of the patient, implant it under the skin of a lab animal like a rabbit, and watch that rabbit throughout his lifespan would oftentimes get the same chronic inflammatory condition as the patient. Anyways, he came back 5 years later, told everybody, we got to quit doing these. Kind of too late. Cat's out of the bag. All the dentists were loving it. The patients were loving it, and they kept doing it. To this day, they're being done. Again, the dentists are taught this is a sterile technique. Unfortunately, it's not. So if you suffer from a chronic disease, you feel like you've been stewarding your health, especially if you can timeline it back to a root canal, I would recommend you find a biological or holistic dentist. They can do what's called a cone beam. That's a 3D CT of your mouth. Regular x-rays don't pick this up. On that girl I mentioned, she actually ended up at the hospital before she got to the dentist because she was in such pain. The oral surgeon did a regular x-ray on her, said she was fine. You've got to get a special 3D CAT scan of that mouth. And only certain dentists know about this. So look up a holistic or biological dentist in your area. And root canals are one of those things God never intended our body to have. Remember, all we're doing here is trying to educate you, give the body what it needs, avoid what it doesn't. And if you can do that pretty good, it should fix itself. It's designed to fix itself. It's programmed that way. That's the designer's program. And it will do a lot to try to fix itself. But sometimes it's hard to overcome when you're nutrient depleted, when you sit all day, when you're so stressed out. All these things compromise the body, and then boom, that root canal is one last toxic exposure that your body just can't handle, and you crumble. So in some patients, this is one of the major drivers of their disease. So get educated, walk it out, be healthy, be made whole. VeritasWellnessMember.com is a website. Our wellness navigators are standing by with our wellness program. You can do that individually, or get your boss to sign up your company. We do corporate wellness too. And it's not your regular corporate wellness. This is the truth. Cholesterol, high cholesterol, it's actually good for you. You just don't want it inflamed. Regular cholesterol panels ain't going to tell you that. Our cholesterol panel will tell you if you're inflamed or not inflamed, because that's what matters. High and low doesn't matter. And there's so much more, guys. So you can check out the corporate wellness program, hit up your boss, tell them to call us. We'd be happy to hook them up with our corporate wellness director and our representatives that can explain what we do. But our goal is to help everyone get healthy. But the problem is we can't get you healthy. No doctor can get you healthy. Only you can get you healthy, but you need the knowledge. So we are here to teach you and walk with you and show you and point you in the right direction and encourage you and cheer you on and do whatever we can to help you not need that system that's failing. The United States healthcare system, in quotes, it's sick care. It's pharmaceutical symptom management. It is failing. It is crumbling beneath our feet as we watch it go down, and it's awful. Unfortunately, I hate to see this happening, but it was so predictable. A lot of us have been saying this for a long time. There is no way you can medicate your way out of something you behaved yourself into. Actually, you ate yourself into. And there's no way to eat yourself out of something you thought yourself and behaved yourself into. So guys, you got to bring it all together. The eating, the movement, the hydration, and most importantly, your thinking. Peace, true peace in your heart. When the truth comes in your heart, the truth will set you free, guys. So we'll see y'all next time. Thanks for joining today.